Hi, my name is Brittany, and this is my health campaign project for APC 201. Just an overview, all the STDs talked about infect both men and women. They can be spread through anal, vaginal, and oral sex, and also physical intimate touch with an infected partner. All of these STDs can be asymptomatic, meaning that they usually do not show symptoms, which is very concerning. Starting off first with chlamydia. The most commonly reported STD in the United States, with an estimate of 1.8 million cases in 2017. It's most common among youth, aged 15 to 24 years old, with almost 2/3 of new chlamydia infections occurring between these youth. It can be caused by an infection with the bacteria Chlamydia trachomatis. If a man is infected and he is having sex with someone, he does not need to ejaculate to be able to spread the disease. It can also be spread from an infected mother to her child during childbirth. Chlamydia can cause some serious problems if left untreated. It can cause cervitis in women and arthritis and proctitis in both men and women. It can also cause permanent damage to a woman's reproductive organs and also pelvic inflammatory disease. Also, this can cause one's chances to be increased of getting HIV or AIDS. Now here's a chart from the CDC which clearly shows that most chlamydia infections occur between, again, youth aged 15 to 24 years old. This is very concerning because my target population for this whole project is college students who are usually aged between 17, 18 to 24 years old. Symptoms of chlamydia. If a woman has untreated chlamydia, she may experience abnormal vaginal discharge and a burning sensation when urinating. The same thing goes for men. Also, one can experience an infection in their rectum, which can lead to rectal pain, discharge, and bleeding. Moving on to gonorrhea. In 2017, there were 600 cases reported to the CDC. It is caused by infection with the Neisseria gonorrhea bacterium. It can infect the mucous membranes of the reproductive tract in both men and women, and also the mucous membranes of the mouth, throat, eyes, and rectum. Untreated gonorrhea. In men, it can cause a painful condition in the testicle tubes, and also in rare cases it can cause a man to be sterile. Again, this disease can cause PID in women, resulting in infertility and an ectopic pregnancy, with a pregnancy outside of the womb. Gonorrhea has actually developed an antibiotic resistance. There is basically only one medication that can actually treat gonorrhea, which is a class of antibiotics called cephalosporins. It has basically developed a resistance to nearly all of the antibiotics used for treatments beforehand. Symptoms of gonorrhea. In women, they can experience a painful and burning sensation when urinating and increased vaginal discharge. Men can experience the same type of burning sensation when urinating and a weird discharge. Both men and women can experience, again, an infection in their rectum. Moving on to trichomoniasis, or trich. It's one of the only diseases caused by a parasite, and it is estimated that 3.7 million people infected are in the United States right now, with only 30% showing symptoms. Untreated trich is passed from an infected person to an uninfected person during sexual intercourse, again, like other STDs. People with a trich don't even know that they're actually infected, and it's actually more common in older women than younger women. And it can increase one's chances of getting HIV or being infected with it much easier. Symptoms of trich. It's actually very hard to diagnose trich. Most people don't even know they have it, so you need to go to a doctor and have them run some lab tests to really figure out if you have it. Women and men can experience itching and burning and discharge. For treatment for chlamydia, it can be cured with antibiotics. The same as for gonorrhea, but the CDC recommends dual therapy or using 2 drugs to treat it. And with trich, it can be cured with a medication that is pills, and this is safe for pregnant women to take as well. But the best treatment is practicing safe sex. So one should always use condoms when they are engaging in sexual intercourse. Try to stay in a really, long relationship with one person where you both agree to be sexually active with just each other. Get vaccinated, reduce your number of sexual partners, and if you can, try to stay abstinent. Here are my references. Thank you for watching, and just get checked and protect yourself against all these STDs and everything, and be safe. Thank you.